And look who's here. It's Dr. Mensink. How are you, Doc?
I'm doing good, man.
It's good to see you again.
Yes.
It's been a while. It just couldn't get our schedules on the right track, so we didn't get to see each other. And so, who'd you bring with us?
I brought
today?
Dr. Swati, David Swati,
Dr. Swati, nice
from
to meet
Stockdale
you.
Radiology, and
nice to be here.
he does our imaging for us now at the practice, and this is a breast cancer awareness month. So what I thought we would talk about breast cancer and breast cancer screening, and who better? I mean, our radiologist, and what a lot of people don't know. Dr. Swati is one of the few people in town that has a fellowship in women's imaging issues.
Is
a
that
special
right?
training.
They have
extra.
a special deal for that.
Yeah, to do better job. So that's why I thought, let's get him on board here. One of our local experts in town, and let's talk about it.
Well, as a matter of fact, we just went through a scare. Laura had to be called back. My wife was called back for a second mammogram.
Yeah, we should talk about that.
There's three things, right? There's positive, there's negative, and then what's the third one, Doc?
Maybe.
Maybe.
Yeah, come back in 6 months, right?
Well, typically...
Get a little closer to the microphone.
Sure. What you start off with is a screening mammogram.
Mm-hmm.
So that's if you're asymptomatic, no problems, you want to do your annual mammogram. So you can say out of 1,000 mammograms, about 100 will be recalled.
Okay.
For either extra...
Now, that would be like
and that's
Laura.
that's pretty scary.
Well, give them the statistics about that.
Well, extra mammogram images or ultrasound, and maybe 20 of those would be recommended for biopsy.
Okay. Only 20 out of the 100?
No.
Out of the 1,000.
Out of the 1,000?
Yeah, out of the 1,000.
Okay.
So, and then about 5 would be diagnosed with breast cancer.
Yeah, so that's not very much. I mean, if you...
But it's still scary. And
well, of course.
It
is,
scary.
of course.
Yeah.
I mean,
especially
we don't want to
when you've got it in your family. My mother-in-law had breast cancer.
Sure.
There's people in her family who've had it. And so that becomes a little frightening thing. I got a scare a couple of years ago with my white blood cell count was down, way down. And my father died of leukemia back in 1986. So I had to go back in for multiple tests. Yep. Thank God there was nothing there. It was just a fluky little test.
Anytime you have to go in for a biopsy, it's extremely nerve-wracking.
Yeah, it's really, it is.
Now, the other side of the coin, maybe what I thought we should do is talk a little bit, Dr. Swati, about actually the statistics about if you don't do your mammograms and when you should do it.
Because what happens then?
There's a lot of information about that, even though this is few. I mean, here's what you've just said. Out of 1,000 mammograms, 100 are going to come back with some abnormality. Of those, 20 are going to go to biopsy, and 4 or 5, I think, ended up with actual cancer. So it's 4 or 5 out of 100. So it's not much. But tell them the other statistics, because it's important to do.
Here's the thing on your point. If you said your wife had a family history.
Yeah. Mm-hmm.
So if you have a family history, first-degree relative, mother, daughter, sister, you have a 2 times increase of breast cancer. So the American College of Radiology and the American Cancer Society actually recommend that you get a baseline 10 years before the age of diagnosis of that breast cancer. So you want to be proactive in that.
10 years before.
So if, let's say your daughter has if you have a daughter, her mother has breast cancer. So she would want to get her, and she was diagnosed at age 40. Mm-hmm. She would want to get a baseline mammogram at 30.
At 30.
At 30, just to be proactive.
Now, many have suggested, and Barack Obama has actually done this, that having that you don't need the breast exams as often when you're over 50 years old. Is that crazy talk or what?
Well, here's the thing. First of all, in 2009, the United States Preventive Task Force came up with a recommendation that you do not need annual mammography at age 40.
At 40.
But every respected scientific medical expert in breast cancer and or imaging has refuted that. So, and actually the federal government has prohibited at this point Medicare and private insurance from banning or adhering to those recommendations.
Okay. So that is
gone.
That's gone.
That's gone.
Good. Okay,
so
I did not know that. That's great to hear.
The traditional screening research holds through.
At 40, it's once per year?
Well, the American Cancer Society, the American College of Radiology, and the Society of Breast Imaging recommends annual screening mammography beginning at age 40. And here's the other thing. So if you skip a mammogram, let's say every other year, you're likely to miss 30% of breast cancers.
Wow.
So you want to get a mammogram every year, beginning at age 40, unless there's a significant family history.
Mm-hmm.
What we recommend at the practice is yearly mammograms, because here's the fact of the matter. Most people can't remember
when they had
it last. All right.
Yeah.
It just becomes it's yearly. Do it. It's the way it is, kind of thing. Number two is that it just the payback may be small, but if you're one of those that gets in trouble, it is oh my gosh kind of thing. And a lot of people don't realize those that have family histories. You see somebody comes in with mom had breast cancer, 2 aunts had breast cancer, my sisters had breast cancer. What's the first question we ask? I mean, these people, a lot of people don't realize, but many of these people have certain gene abnormalities that follow through in these families and have a much, those are the ones that have that high propensity that you cannot miss. And those, I mean, we have patients that we do yearly. In fact, we have patients, I have a couple that we do every 6 months because they've got the BRCA antigen 1. And they are high risk, and everybody in their family, and they don't want to consider to take their breasts off, and we understand that, but they are at high risk. The other thing that's important, Jazz, and I look at this, and because we're into a practice where I have time to do real good medicine, do a lot of preventative stuff. You want to, these people, and it's for everybody, but you want to really look after their immune system, make sure their immune system is up here, not down in the basement kind of thing. These are not people that you want to be living on potato chips and fries every day kind of thing.
Gotcha. But
high fatty diets have been shown to increase.
Is that right?
High fatty diets and unopposed estrogen. But the breast cancer genes he's speaking of, these are normal genes. We all have them. But it's mutations to these genes. It's thought that it's involved in DNA repair. So if you have a mutation to the breast cancer 1 or 2 gene, you could have a lack of that repair mechanism. So it would just shorten the series of events that's necessary to the breast cancer. And those patients have a 50% chance of getting breast cancer. And the breast cancer 1 is also associated with an increased risk of ovarian cancer as well.
Yeah, and pancreatic, I think, too, if I remember right.
It spreads through the whole body if it's not checked inside. Right?
That's
any cancer.
That's any cancer, but that's called metastasis.
Yeah, this is what happened to Laura's mom. I mean, it riddled her body before. Do you know how they found out?
How?
She had a dog named Emma. Emma was an English Mastiff. Is an English Mastiff. She's living with family now. But that dog got up in her lap on the couch and started sniffing around her breast and would not stop and just was obsessed. And so she said that Mama said she had heard that dogs can sometimes sense this. And she went in for a mammogram earlier than she was required to by the doctors. And sure enough, it was discovered.
I've heard that before. That's interesting.
Yeah. I don't know what it is. They have this super sense of smell. They can pick these things up. Channel 17 even did a special report on Mama because of that. But sadly, too, it went so fast. And it does. It's not something to be trifled with.
I'd like to make a point, if you let me.
Sure.
We're talking about family history and increased risks and getting your mammogram, but I think the women need to know that 75% of the diagnosed breast cancers are in women who have no family history.
Is that correct?
Or no associated risk.
Yeah. What was the percentage?
75%.
75%
of the diagnosed breast cancers are in women who have no family history or associated increased risk.
Well, then what's the percentage of? Is it?
It's statistical bad luck. So you need to get in and get your annual mammogram.
Even if there's no history in your family, ladies, you've got to get this.
Here's the other thing, Jazz. If you are black, all right, African American black, it's rare before menopause for non-blacks to get breast cancer, but the rate for breast cancer for blacks before menopause is I had it written down here, but it's just goes way up. So if you're black, we look at blacks who have some of the risk factors. We can maybe go over some of those, but be more aggressive. These women should, if there's any question, they should get mammogrammed earlier than later.
Absolutely.
Now, and the sad part, in our experience with the blacks, many of them, because of some insurance issues or financial issues, they're the last to get their imaging. Maybe here's the other thing that we should probably announce.
I think it's an economic issue because I think genetically they may be less prone to it, but they seem to be less likely to go in for their annual
that's true.
So you're going to find it at a later stage.
At a later stage, so you don't think it's genetic? It's just socioeconomic situation.
Absolutely.
Gotcha.
Well, here's the thing, how I look. In fact, Dr. Swati is going to make an announcement very, very shortly to something about this. But mammograms are expensive. I think it's $120 to $140 the average mammogram. Now, the good thing is if you have insurance, they're mandated under certain guidelines to pay for it for free. That's the good thing. Everybody should know about that. So if you have insurance, you need to say, I need doctor for you to order this. End of discussion. It's free. That's the way it goes, kind of thing. And there's certain guidelines that the insurance will go for. But more important, if you have no insurance, and part of it, I look at this as sort of the benefit of more and more patients, and we're able to have a little bit more economic muscle. But 2 years ago, we were paying $75 instead of for our patients for mammograms. Last year, we got it down to $70. And this year, how much is it per mammogram that we've?
For uninsured patients, we're offering a cash price of $65.
Now that's unheard of,
Wow,
Jazz. $65, and
That's over half.
And here's what here's what he's going to do. Yeah, and here's what he's going to do. Stockdale Radiology is going to do. They're going to open this up to the public so that they can just call in and make an appointment, or they can come to our office without an appointment, join the practice, and we'll give them a slip of paper and tell them where to go for it. So that'll help a lot of people in the community. You don't have to have a doctor.
Not just for October, throughout the end of the year.
Throughout the year. Fantastic.
Yeah. So to me, this is a big deal.
This is a big deal.
This is a big deal. Essentially, you have some places we're offering free mammograms for a day or two or something like that. This is till December 31st.
That's a great
$65.
It's a great opportunity for women to.
It's important.
Yeah, it is.
Important.
You're darn right, Dave.
I want to mention this. Mammograms it's important to find these cancers small. Obviously, 10 millimeters or less. Because when you do that, the 5-year survival rate, if there's no associated adenopathy or any other involvement, is greater than 95%.
If you catch them early.
That's why you want to find them early. And you can find changes in the breast on mammography 2 years before they're apparent by the patient or the clinician.
Wow. We'll be right back, folks. More to come. I want to find out what are the downsides to mammograms.
Maybe we should talk about the radiation risk.
Okay, let's talk. There you go. The radiation risk. Yes, maybe every 5 years. Would that make the insurance companies happy, perhaps?
Probably.
Yeah, probably. We'll be right back. More of the Jazz McKay Show after this.
KNZR. Jazz McKay on 1560 AM and 97.7 FM KNZR.
Talk to the docs this afternoon on the program, 2 for the price of 1. Let's go to Peggy. Hi, Peggy. How are you, hon?
Oh, hi. I'm good. I'm just wanting to know, I've heard that if you have a lump that you find on the upper portion of your breast, that it's something to worry about, but if it's on the lower part, it's probably nothing to worry about.
Peggy, dead wrong.
Yeah, majority of the breast cancers occur in the upper outer quadrant. That's where most of the glandular tissue is. However, finding a lump of certain characteristics anywhere in the breast is always of concern.
2 things that have to be remembered. When you have the breast is made up of a whole bunch of tissues, all right? Lobular glandular tissue and then ductal tissue. And those are the and fibrous tissue. And those are the 2 most common types where it comes from. But you can have cancer from almost any part of the tissues in the breast, and it can be anywhere. I mean, it depends. I would strongly encourage you, Peggy, you need to see a doctor and let them look at it. How old are you?
Well, I understand that most of the breast cancer is detected from the upper part of it.
But it can be from anywhere. You can have breast cancer.
I don't have any. I'm just thinking if I find some in the future. That
okay.
I don't have to
hypothetical.
Peggy, it is true that, as Dr. Swati said, and he's the expert here, literally. I mean, in fact, he's had extra training in women's imaging for this. But what he says is true. But here's the thing, Peggy, that statistically maybe so. But if you, as a woman, get a lump in the lower, inferior quadrant, you need to be seen and checked. I can't stress it enough. It's not good enough to say, well, they're mostly in the upper outer quadrant. Oh, we'll forget about it. Big mistake.
No.
Now, the other side of the coin is that most, if you're under 40 or under menopause, not in perimenopause, the chances of breast cancer are small unless you're black. It goes up if you're black. But you still need to be looked at. All right? I can't say that strong enough to women out there.
Now, I've got one more question, a follow-up. Now, what if everybody knows that when you get older, your breasts droop. Now, your breasts used to be up a lot higher. So what about that skin that is no longer having breast tissue in that? Could that possibly be something you need to look out for?
Here's the thing: as women get older, the connective tissue in the breast and also the skin fibrous tissue gets lower. Okay, and their breasts will droop. What you say is true. And probably the funniest story that I've ever seen was a lady who was 95 who came into the ER years ago, and she had breasts that were hanging down to her umbilicus, and she would roll them up and stuff them into her bra, kind of thing. And she had no problem with it. And I remember looking at it. That's the first time I ever seen it. Last time, but that happens. But here's the thing. You can have breast tissue anywhere there, and you can also have breast tissue. A lot of people don't realize, but it goes
under
up
the arm.
It goes up into the axilla. There's a little tail. Do you have any comments about that, Doc?
Yeah, you can have accessory breast tissue, but
yes.
there's types of breast patterns, and traditionally type 1 and 2, which are fatty and just average amount of glandular tissue, are the most common. And as you get older, that involutes, and the fatty tissue replaces the glandular. So the drooping tissue most likely is fatty tissue, and if there's no glandular tissue, there's no TDLUs or terminal ductal lobular units. That's where the cancer originates from. So there would be, I guess, a decrease risk for breast cancer if it's all fatty tissue with no glandular.
I did not
Interesting.
know that.
But if you have other types of dense breast tissue, they don't regress, so you should always keep an eye on it.
Well, in my glory days, they used to be up to my collarbone, I swear.
We won't ask anything more, Peggy.
Hubba, hubba, hubba.
Thank you ever so much, Peggy.
Thanks for calling, Peggy. What is the deal? I mean, why would anybody dispute having mammograms twice a year as a normal? I mean, is there something?
No. Oh, once a year, every year.
Well, let's
talk about the radiation dose, okay? Because I think
that's what I think. I think that's what I'm hearing from people is that they're giving me the assumption that somehow the dose of radiation is far more damaging than whatever's going. Now, that's just insane to me.
Well, in fact, speak to this because in your office Stockton has special radiology equipment that literally is, I think it's 40% less, or is it?
Actually, yeah, the digital mammography unit we have offers about 40% reduction in radiation as compared to the other digital exams, but there hasn't been any scientific research to show that there's been any causes of breast cancer due to the radiation produced from a mammogram.
That's what I thought.
Yeah, that's probably the most important message to get out there to women.
Yeah, that's what I thought. Because I mean, I've tried to understand who would suggest that there should be limits on how often a woman should.
It's a focus area of radiation, so you want to always be aware of it, and you want to limit it as always, because you don't always know. And then the thyroid is there too, so there's been controversy about that. So you wear a thyroid shield if you must. But overall, I don't think there's any increase in.
Has there other than just the changes specifically inside the machines? Have there been changes, dramatic changes in mammography since it began? And when did it begin? When did imaging of this nature begin? What year do you know?
I don't know the exact year, but I think the first mammograms came out in the early 70s.
Really? So it is very young technology.
That's old.
How did
40 years. My
40
gosh.
years.
Wait, no, seriously. I was alive. So it couldn't have been that long ago. I was.
Well, Jazz, I've heard statistics,
alive.
but I think the average CT today, radiation exposure with low-dose CT, has less radiation than the average chest X-ray 10 years ago. Is that correct?
Depending on the amount of detectors on the system, the more detectors, the lower the radiation.
Right. It's amazing.
But there's amazing things happening.
Listen, I mean, this. Because they got to complain to you. Women hate it. Women hate the mammogram. Am I right? I mean, I don't know. I can't imagine having any part of my body squished between two glass plates. But I imagine it's not.
Jazz, no, that's true. But here's the bottom line: men hate rectal exams and prostate exams more than women hate breast exams.
Is that true?
Yes.
I think I would rather have that than have any portion of my anatomy smushed between two glass plates. My wife dreads it.
But here's the thing. I mean, mammogram is a great screening tool.
Yes. Oh no, I don't.
And we don't really have a great screening tool for the prostate.
Right.
The imaging is okay, but it's not very specific or sensitive. So you have the clinical digital exam and the PSA.
Yeah.
So that's what we go on.
Yeah.
So if we had a mammogram for the prostate, well, we would have to endure it.
Yeah, it'd probably suck. I can't. No, but I just don't think that. Not to get specific, but I don't think that is nearly as. To me, it doesn't seem nearly as painful as the mammogram.
Another thing that's important, Jazz, for women to realize, but there is a correlation. We sort of touched on it a bit, but if you have family history. Mm-hmm. Number two, if you have, there's a correlation between ovarian cancer, breast cancer, uterine cancer, and some of them even prostate cancer. I mean prostate, pancreas.
Well, men get breast cancer too, right?
So, well, like I said,
less than 1%. Yes.
The BRCA2 gene has an association with male breast cancer.
Yes. Yeah, so it happens.
Yeah,
it happens.
It happens.
So let's the offer again. It goes through December 31st.
Yes, sir.
Let's talk about that one more time.
Essentially, come to our office. You don't have to make an appointment. This is above that we do as a public service to the community. Or you could call up Stockdale Radiology and make an appointment. And $65, and not only for this month, for the end of the month, right to the end of the year, to the December 31st, women get your mammograms. This is a phenomenal deal. Now, if there is a problem with them, then you will end up, we will, they will let you know. If there's a problem, then essentially, then you'll need to see a physician and come to practice or see someone else if there's a problem. But we kind of look at this as a sort of like a public service because it is something that's needed for women in this community.
Absolutely. All right, give them a call at the practice. The number is 871-3300, 871-3300, 871-3300. And you don't need to make an appointment, ladies. Just come in and we'll give you get you the referral slip and Stockdale Radiology will hook you up.
Now, Jazz, before we leave, one other thing that we mentioned last week, but we have this on next Monday at 6 p.m. at the practice. This addiction seminar, all right? And it's open to the community. Dr. Cowan and Dr. Steinberg are going to do it. And if you have any questions about it, go to our website, literally. And there's Dr. Steinberg did a little 2-minute YouTube clip to explain what it is all about. But that's open to the community. And if you have any issues or you know somebody, bring it.
That's Monday
next month, not this Monday, tonight,
but next
26th. Monday at 6 p.m. from 6 to 7.
Fantastic.
And it's free to the community. All right?
Fantastic. Once again, the phone number, 871-3300 for the practice. Doc, thanks for being here.
Thanks for having us.
Good having you both.